To avoid the entrance of the virus in one farm, there are very important 3 rules, and are related very much with the mechanism that the virus go in. So we have to avoid the entrance of infected animals, wild and domestic. Both are very important. The wild you can do by double fence to avoid the contact. The domestic by a quarantine, an adequate quarantine. And the other point is to never leave swill feeding used. So the leftover of the food used for human can never give it back to the animals. So never use swill feeding of meat that can have meat infected of pigs. And the third one that is also very important, and I think that contribute a lot, is if you have to do a necrosis because you thinking in ASF, don't make blood there. The blood is the most important mechanism of transmissions. So the diffusion of the virus by blood is terribly important. Don't make blood. Don't use blood. Don't make blood in the animals. If you do a necrosis, clean everything. One single drop of blood have more than 3,000 copies of the virus. How to stop that the virus, the cycle of the virus replications in this country? I think in this country you have 2 problems that are the ones that are running around the disease. One is that you put animals in the slaughterhouse that are infected or carriers. So that means animals that are sick, but probably don't look like, but they are. And so you send it to the slaughterhouse. When the slaughterhouse is sacrificed, the meat of these products are going to produce food. This food is going to be contaminated. And later, you are going to give the leftover of this food, like a swill feeding, to feed your animals. So you start with animals that are infected. The animal infected go to the slaughterhouse produce the meat, and the meat again is going to produce salamis or sauces. They are going to be eaten and fed to the pigs, and they're going to be infected. This is the cycle that you are doing already in Asia all over, one over after over, and this is a disaster. Important for detecting ASF in a farm is to have a very clear early detections of the disease. So you have to remember what are the important clinical signs that the disease show when the animals are infected. And normally in a naive area, these diseases appear in acute form. So you're going to have fever in the animal, you have to have erythema and lesions on the skin, that's in high fever, very high fever. So once that animal are in these conditions, they die, and if you do the necrosis, you should look several different tissues. One is lymph nodes. Lymph nodes are always hemorrhagic and always are congestive. You also have to look to the spleen. Normally all ASF have a splenomegalia. This is another important issue. The third one is hydrothorax or hydropericardias. When you have any of these, please call the veterinarian, the official veterinarian, because probably you have ASF. The diagnosis in one disease like ASF is critical, not only important, critical. And it's very important to have an early detection and a good diagnosis. And the most important for the diagnosis is to remember how the disease can be presented. Normally, the disease presents with fever, especially in naive areas, with fever, very high fever. The animals have lesions and skin lesions, erythema, hemorrhagic, and skin lesions. They are very cold, they're feeling very cold, even that they have high fever. And if you open the animal, you will find 3 important things. You're going to find the lymph nodes, most of them with congestion or absolutely hemorrhagic. All of them are affected. So look several lymph nodes and see if they are affected. The other points that you're going to see is going to be problems in the spleen. You're going to have large spleen. You're going to have a splenomegalia. The spleen is going to be dark and friable. It's going to be broken easily. And finally, you can have hydropericardias and hydrothorax, and most of the animal affected. If you see 4 of these, or 3 or 4 of these lesions, call immediately your official vet. best way to avoid the infection by feed the animals. That is a mechanism here very useful because they are very bad for the virus is very good, but very bad for you, is to avoid the swill feeding. Swill feeding is terrible because normally, as I mentioned before, you have animals in a slaughterhouse that are infected. So don't use the swill feeding. Tell your worker not bring to the farm food from home. Not use any kind of food from pigs in the farm. Never. The swill feeding has to be absolutely avoided. As well as you have to avoid the use of blood for increase, for feeding with the blood, Never use that. Blood, swill feeding, the worst things you can do it.